Positive parenting. About 1 in 5 kids in the United States lives with a parent with severe depression. Well, now a new study out of the University of Georgia says the effects of that can follow kids into adulthood. News 4 Tucson's Angelique Lizardi has the study details and some protective factors that can reduce the child's risk.
Maybe it's their looks or personality. There are many things that parents pass down to their kids.
It's the influence that their parents have on them.
Developmental health psychologist Katie Ehrlich wants to know how living with a depressed parent influences a child's physical health down the line. Researchers collected data from about 400 kids 6 times during an 8-year period from ages 11 to 18.
We had their parents self-report their depressive symptoms.
Then when the kids were 25, they were asked to report on their own ability to avoid temptations and engage in healthy behaviors, like eating a healthy diet and exercising. The researchers also took blood samples.
What we found was that that accumulation of risk of living with a depressed parent across adolescence was a risk factor for the onset of metabolic syndrome at age 25.
Metabolic syndrome is a cluster of factors such as obesity, elevated triglycerides, and high blood pressure, which can lead to diabetes and heart disease.
We're looking at closer to a quarter of our sample, maybe even closer to a third of the sample that has metabolic syndrome at this point.
But Ehrlich says that there are some protective factors that can reduce kids' risk. The kids in the study who maintained healthy lifestyles and had high self-control were not at risk for metabolic syndrome in adulthood. This suggests that kids living with a depressed parent won't necessarily have poor physical health, but it's important for them to focus on developing healthy habits and self-control so they can avoid physical health problems in adulthood. We've got you covered. Angelique Lizardi, News 4 Tucson.
The researchers have received funding to follow the kids for another 5 years into their 30s. They say half of these young adults now have kids of their own and have started to recruit the next generation into their study.